Good evening, everyone. Welcome to our Georgia Department of Health Provider Outreach webinar. My name is Dr. Alexander Millman. I'm the Chief Medical Officer at the Georgia Department of Public Health, and today we'll be discussing promoting COVID-19 vaccination. So the objectives of today's webinar are to assess the safety and effectiveness of the COVID-19 vaccines, to discuss the importance of having conversations with patients about getting the COVID-19 vaccine, in particular, discussing COVID-19 vaccination among vaccine hesitant patients. And I am also joined tonight by Sheila Lovett, the director of the Georgia Department of Public Health Immunization Program, who will also be able to provide additional information on next steps that you can take in your role as a provider, including information on upcoming vaccine provider enrollment webinars that we will be hosting. So the bottom line for COVID-19 vaccination is that the Centers for Disease Control and Prevention recommend that everyone 12 years of age and older get vaccinated against COVID-19. COVID-19 vaccines are safe, effective, and they reduce the risk of severe illness among people who are infected with COVID-19. More than 178 million people in the United States, including 4.5 million Georgians, have received COVID-19 vaccines under one of the most intense safety monitoring programs in United States history. So if we look at the situation with COVID-19 epidemiology in Georgia, we can see on the left the number of confirmed PCR cases over time, and on the right, the number of confirmed deaths due to COVID-19 over time. And as we know, there have been waves that have occurred. Most recently, over the summer, we experienced the Delta wave, which was one that rivaled that we experienced during last winter prior to the Delta variant. We can also see that the number of deaths that have occurred during the Delta wave in Georgia have been very high, rivaling what we had previously thought as our peak during the previous winter of 2021. Fortunately, as we can see now, the number of COVID cases as well as the number of COVID deaths in Georgia have been decreasing in recent weeks. So when we talk about COVID-19 vaccines, there are currently 3 COVID vaccines that are authorized for use in the United States, 2 mRNA vaccines and an adenovirus vaccine. The Pfizer-BioNTech vaccine has 2 doses and is given at least 21 days apart. And the Moderna vaccine is 2 doses and given at least 28 days apart. And then for the Johnson & Johnson-Janssen vaccine, it is 1 dose. Additionally, at this time, an additional 3rd dose of Pfizer and Moderna are authorized for patients who are immunocompromised. And CDC and ACIP also recommends Pfizer booster shots for people who are 65 years and older and residents in long-term care facilities, those aged 50 to 64 with certain underlying medical conditions, those aged 18 to 49 who are at high risk for severe COVID-19 due to certain underlying medical conditions, and those aged 18 to 64 years who are at increased risk for COVID-19 exposure and transmission because of occupational or institutional settings. Data for Moderna and J&J booster doses have been reviewed by the FDA Advisory Committee, and those were recommended for use. And this week, ACIP and CDC will be reviewing data to provide recommendations for populations for Moderna and J&J booster doses. So this is something that should be changing very soon. If we look at the vaccine effectiveness from the literature on the 2-dose mRNA vaccine, so the combined effectiveness for both Moderna and Pfizer, these are studies from early on in the pandemic after the vaccines had just been developed. And as you can see, both of these vaccines are highly effective at preventing hospitalizations and deaths, with vaccine effectiveness for both of those outcomes in the 90 and greater percentages. Similarly, 3 studies from the United States also found that for people who were fully vaccinated with the mRNA vaccines, the vaccine effectiveness against infection was also in the high 90s. However, we have seen some changes over time. So if we look at the Pfizer and the Moderna 2-dose effectiveness, looking at the Alpha variant versus the Delta variant from studies in other countries, one thing that we can see based on these data are that there's variations in effectiveness that have been found looking at the Alpha variant and looking at the Delta variant. The Alpha variant is shown in the blue circles on the graph, looking at both the vaccine effectiveness against infection, symptomatic disease, and hospitalization. And in the red triangle shows the vaccine effectiveness against Delta virus. And one thing that we can see in this is that while the vaccine effectiveness continued to be high with the Delta variant for the most severe outcomes, such as hospitalization, we can see that there was a decrease in the vaccine effectiveness against the Delta variant for other markers, such as symptomatic disease and against infection in the 4 studies that have been shown here. Similarly, when we look at data from the United States that happened more recently after it in the period of time approximately 6 months after the vaccination had been received, we can see that on the top figure, the vaccine effectiveness against infection for Moderna had declined from what it was initially, when it was around 90%, to about 76% when these results were reported in July compared to those from January through May. But we can see the vaccine effectiveness for Pfizer had declined to about 42% in July. So there's some evidence of waning that had occurred in terms of the vaccine effectiveness against infection. However, the vaccine effectiveness against hospitalization, while slightly lower than it had been in the early days after vaccination, the vaccines were still highly effective against against severe outcomes such as hospitalization and death. Nevertheless, these results helped to prompt the CDC and FDA decisions to institute a booster dose program. However, what I do want to emphasize is that even though there have been cases of waning immunity, even though there have been breakthrough infections that have been reported in the media, vaccination continues to be the best tool for preventing COVID-19. If we look at the key points on incidence of COVID-19 cases, hospitalizations, and deaths by vaccination status in 13 US jurisdictions from April through July of 2021, we can see that even after the Delta variant became the most common variant circulating in the United States, fully vaccinated people had a reduced risk of infection, about 5 times compared to their unvaccinated peers, a more than 10 times greater risk, reduced risk of hospitalization compared to their unvaccinated peers, as well as a greater than 10% reduced risk of death compared to their unvaccinated peers. So even in this setting where we may have been hearing cases of breakthrough infections, we may have been hearing about waning immunity and the need for boosters, the bottom line is that vaccination continues to offer strong protection against COVID-19, and it's by being vaccinated, even if there is a situation of waning immunity, the person is going to be at decreased risk of infection, hospitalization, and death. Vaccination continues to be our best tool for preventing COVID-19 infection. If we look at the adverse events that have been reported through VAERS, just the most commonly noted adverse events that people have received from mRNA COVID vaccines are generally symptoms that one associates with vaccination, such as having some headache, some fatigue, some injection site pain, generally pretty mild symptoms, not symptoms that are usually requiring hospitalization or symptoms that are requiring extensive intervention to be able to control. And people who do have these symptoms, they usually resolve in a short period of time, usually around 24 to 48 hours after vaccination. However, there have been some rare adverse events associated with COVID-19 vaccines. So for the mRNA COVID vaccines, the one that comes to mind are cases of myocarditis and pericarditis. And these have usually been reported among adolescents and young adults who have received their second dose of the mRNA COVID-19 vaccine, both Pfizer and Moderna. So while this is not, while these vaccinations can still be given to adolescents and young adults, it's just important to note that this is something that has been reported to be associated with it, and it's important to be on the lookout for signs and symptoms of myocarditis or pericarditis in any patient who has received an mRNA COVID vaccine, but especially in adolescents and young adults. For Guillain-Barré syndrome, one thing that's important to note is that people who have previously had Guillain-Barré syndrome may receive a COVID-19 vaccine. To date, there have been no cases of Guillain-Barré reported following vaccination in participants who had received mRNA COVID-19 vaccines in the clinical trials. There was one case of Guillain-Barré syndrome that was reported in a vaccinated participant in a Johnson & Johnson clinical trial, and over the summer, FDA had revised statements on Johnson & Johnson vaccine because of adverse events that had been reported through the VAERS report surveillance system related to Guillain-Barré, noting that there was an increased incidence that was found in Guillain-Barré vaccine recipients, although there were very few cases that were reported and no causality was able to be identified. But out of an abundance of caution, it has been recommended that while individuals who have had a history of Guillain-Barré syndrome in the past, there's no contraindication to receiving the Johnson & Johnson vaccine, should somebody have had that history of Guillain-Barré in the past, if there is an mRNA vaccine that can be offered to that patient, that should be something that is discussed between the healthcare provider and the patient about using an mRNA vaccine as an alternative in a person who's had a history of Guillain-Barré. But overall, these adverse events are rare. Those who have had myocarditis have generally been able to recover from it in a short period of time. And even with these adverse events, the known and potential benefits of COVID-19 vaccination outweigh the known and potential risks that are associated with the vaccine. So while it's important to be able to describe these risks and any adverse events with patients and to be able to address their concerns, know that the risk of being unvaccinated and having an adverse event from a COVID-19 infection is considerably higher than the risk of having a rare adverse event with one of these COVID-19 vaccines. So for patients who do get vaccinated with a COVID-19 vaccine, one of the safety monitoring tools that is used is the vSafe system. You can give this handout to patients at the time of vaccination. And the other thing that we would encourage providers to do with the patient is to counsel them on the importance of enrolling in vSafe so that they can report any symptoms that they have to try to help with CDC's adverse event monitoring program. VAERS is another adverse event reporting system. It collects and reviews reports of adverse events that occur after vaccination. And this is one where any health problem or side effect that happens after vaccination gets reported. This is very important as it allows allows CDC to be monitoring adverse events that could be occurring, so that they can try to detect signals to see, is this actually related to vaccine, or is it something that's related to normal background that we would see of certain conditions. So anybody can report to VAERS, including family members, patients, healthcare providers, manufacturers, and the general public, and VAERS data are available to the public. So healthcare providers are required by law to report to VAERS any adverse event that's listed in the VAERS table of reportable events following vaccination, an adverse event listed by the vaccine manufacturer as a contraindication to further doses of the vaccine. And healthcare providers are also strongly encouraged to report to VAERS any adverse events that occur after the administration of a vaccine licensed in the United States, whether it is or is not clear that a vaccine caused the adverse event, as well as any vaccine administration errors. So this just provides information on how to report to VAERS. It can be done online, or information can also be sent via email or by telephone. So I wanted to just address some frequently asked questions about COVID-19 vaccines, and hopefully these will be helpful for addressing questions that may come up with some of your patients. So for example, can a patient receive the influenza and COVID vaccines at the same time? The answer to this is yes. Those vaccines may be administered without regard to timing. Another question that frequently comes up is, if patients have already had COVID-19 and recovered, do they still need to get vaccinated with a COVID-19 vaccine? And the answer to this is we would still recommend that those individuals get vaccinated. The duration of immunity from while we do know that there is immunity from natural infection, the exact duration of that it's unclear exactly how long that lasts. And there have also been studies that have come out that have shown that among previously infected persons that were unvaccinated had a 2.34 times the odds of reinfection compared to those who had been previously infected who were fully vaccinated. So we can see that getting vaccinated does help protect individuals even if they have been infected with COVID-19 in the past. Another question that comes up frequently is, should I check serology on a patient who has been previously infected with COVID-19 to determine if he or she needs to be vaccinated? And this is one that's very important because it's actually not recommended to check serology on a person who's been infected with COVID-19 to determine the need for vaccination status. At this point in time, with the assays that have been authorized by the FDA, serologic correlates of protection have not been established, and those currently available assays are not authorized for use to try to determine whether or not an individual has the antibodies that would be needed to be able to provide adequate protection for COVID-19 after an infection. Another question, especially during the Delta wave, when we were giving a lot of monoclonal antibodies, is, can a patient who received monoclonal antibodies for COVID-19 be vaccinated? So this is a little bit of a challenging question because there's really no data on the efficacy of COVID-19 vaccines in persons who received monoclonal antibodies for COVID-19. And what CDC recommends is that vaccination be deferred for at least 90 days for persons who received monoclonal antibodies for COVID-19. This is based on CDC's expert opinion. It's not actually a contraindication. So there's actually no contraindication or minimum interval for persons receiving antibody therapy, not specific to COVID-19. So sorry, let me just rephrase that. So for people who did receive monoclonal antibodies for COVID-19, CDC recommends that vaccination be deferred for at least 90 days. For those who received antibody therapy not specific to COVID-19, so for example, if somebody received a rabies immunoglobulin, there's no contraindication or minimum interval for that person to receive the COVID-19 vaccine. Finally, how long does protection from a COVID-19 vaccine last? This is a tough question. Studies are still ongoing to determine the duration of immunity. Vaccines but what we do know is that vaccines continue to be effective against COVID-19. As we've discussed, there are some data that suggest that there may be immune waning after about 6 months, but what we could see from those data that had been presented previously, the vaccines continue to remain highly effective at preventing severe outcomes such as hospitalization and death. So now I'd like to discuss discussing COVID-19 vaccines with patients. So as healthcare providers, you are one of the most trusted sources of information by your COVID patient, by your patients, and they are interested in hearing recommendations that you will provide on whether or not they should receive COVID-19 vaccines. So one thing that's just important to note in having these conversations with your patients is that patients do have concerns that they will let you know about related to receiving the vaccines. Most of the concerns that people bring up are questions about long-term side effects, concerns about whether or not enough testing had been done on the vaccine, concerns about short-term side effects, as well as just other questions about the efficacy of it, and other questions such as, can you get infected by getting a COVID-19 vaccine? Questions, similar types of questions that may come up with something like the flu vaccine about whether or not the flu vaccine can give you influenza. So in terms of trying to have some of these discussions, particularly with patients who might have vaccine hesitancy, just some strategies that you can try to address are you can lead with listening. So try to listen and understand the patient's point of view. You can use patient-centered communication techniques, asking open-ended questions, recognizing COVID-19 prevention measures that the patient may already be taking, asking for permission to share information about COVID-19, particularly for somebody who may seem as if they are hesitant about even discussing the topic. You want to be able to provide them with accurate answers using clear and simple language. You want to acknowledge uncertainty about what we don't know yet about COVID-19 vaccines. It's important to also provide data-driven information on the risk and the impact of infection. The slide says for pregnant women, but not only for pregnant women, for all of your patients. And the most important thing, if the patient is still thinking about it and they're asking you what they should do, is to give your strong recommendation for vaccination if the person meets the criteria that CDC recommends, which is for all individuals age 12 and up to receive a COVID-19 vaccine. So we'd like to talk about next steps for you as providers. And for that, I'm going to turn it over to Sheila Lovett.
Thank you, Dr. Millman. Next slide, please. I am Sheila Lovett. I'm the Immunization Program Director, and so I will review the next steps. So the next step is to actually enroll to become a pandemic provider if you have not done so already. So if you are interested in becoming a vaccine provider, you may join us next week. We will host another webinar that will specifically review the steps for enrollment. And so that webinar will occur October 27th at 5 p.m. We will give a brief overview of the COVID-19 vaccines. Dr. Millman mentioned that ACIP was meeting this week. They'll also be meeting next week on the pediatric Pfizer supply. So that is definitely exciting, and we're waiting for that. And so we'll have some updates hopefully to share with everyone during that enrollment call on the 27th. We'll also review some additional concerns that we have heard from providers who are enrolled or those who are thinking of or considering enrolling. We'll go over the complete enrollment process from beginning to end, and then also talk about the vaccine management system. So that system we refer to as VMS. It's similar to the GRIT system if you are familiar with that. However, it is specifically designed for the management of the COVID vaccine program. And so vaccine ordering, inventory management, and doses administered information can be entered or managed through the VMS system. And then also talk about vaccine reporting and communication tools that we have available or that we're required to do for the COVID vaccine program. And then also there will be discussions regarding the Delta variant and then booster shots. So that is all, we'll discuss all of that next week, Wednesday, during that enrollment webinar. I will say that if you do not have to wait for that webinar to start the enrollment process is an online process that you can access through the GRID system now. There is a link that will say pandemic enrollment on the menu when you sign into the GRID system. So you can start that process now. You do not have to wait until next week, but we will be available to answer questions then. Next slide, please. And I also wanted to talk a little bit about the COVID vaccine storage. So the manufacturers continue to work and study the vaccines to see if it can be managed or remain stable at different in different temperature environments. I know one of the biggest shocks at the beginning of the pandemic was the Pfizer vaccine and the need for it to be stored in the ultra cold storage environment. So Pfizer has come a long way. That vaccine is now stable, not only in the ultra cold storage unit, but also at frozen temperatures, which is normal freezer temperatures for vaccines such as Zostavax or the varicella vaccine or ProQuad, which providers might be more familiar with, for up to 14 days. So 2 weeks at frozen temperatures. The vaccine is also stable, refrigerated, which is in the same temperature control environment as most recommended or routine vaccines today, for 31 days. So that is outside of ultra cold storage, the vaccine remains stable for up to 45 days. There's some information that differs a little bit more that extends that time period for the licensed Pfizer product. And then we are also hearing for the pediatric Pfizer product where those vaccines will be stable for up to 10 weeks. Once they begin to circulate, they'll be stable for up to 10 weeks in a refrigerator unit. So that is great news. And more to come on that as we receive that information over the next few weeks. And the Moderna vaccine, that vaccine is stored in a freezer, normal freezer temperatures as other vaccines, again, zoster or varicella vaccines. The vaccine may also be stored in a refrigerator for 30 days. That vaccine must be kept in its carton to protect it from external light to remain stable. And then lastly, the Johnson & Johnson or the Janssen product is stored refrigerated, normal temperature range, 2 degrees Celsius to 8 degrees Celsius. And the vaccine may also, may be stored for a 9-month expiration date period. So that vaccine is stable for 9 months in a refrigerator. And again, that vaccine also must be kept protected from light. So it's best to keep it inside the carton that it is delivered in for that purpose. Next slide. I believe I'm going to turn it back over to Dr. Millman. Yes.
All right, thank you for that information, Sheila. I would like to just now point you to some vaccine appointment resources that are available that can be shared with patients. We have resources that are online that can be shared if you are not a vaccine provider, for being able to get vaccines at one of our health department locations, as well as resources that are available for individuals to be able to learn more about COVID vaccination, as well as vaccine appointments that you can distribute to your patients. Again, if you are a vaccine provider, you can use your own appointment system, but if you are referring them to the health department for vaccination, please use these resources. I would also just like to highlight one change that has also happened with Medicaid. So as of July 1st, 2021, Medicaid providers can seek reimbursement for counseling their Medicaid patients on the importance of COVID-19 vaccine. For billing purposes, the procedure code is 99401, preventive medicine counseling. The reimbursement rate for this is $28.29, and more information can be found by visiting the Medicaid Georgia website for COVID-19. So I want to thank you all for participating in tonight's webinar. We hope that this information was useful, and we would like to open up the floor to any questions that you may have. We're just going to see if any questions have been entered into the chat box. If you do have any questions, please enter them into the chat box. I see a question of, will this PowerPoint and recording be available for replay later? Yes, we will make this available for you. It will be on the DPH website. Any other questions? Okay, I am not seeing any more questions at this time. I would like to again thank you all for your participation on tonight's webinar. We hope that this information was useful, and we thank you in your interest in learning more about COVID-19 vaccines, as well as your consideration for becoming a COVID-19 vaccine provider. As was said earlier, the PowerPoint and the recording of this will be available on the Georgia Department of Public Health website. So thank you again for all that you're doing for keeping your patients healthy, and thank you again for participating in tonight's webinar. Goodbye.